Hi, I'm Dr. Eric Ehle with Ehle Family Medicine, and thank you for signing up for our COVID video series. I know there's a lot of fear and mixed information going around, and we wanted to be proactive in making sure you have the support you need during this time. Hence the reason I wrote a comprehensive blog post and we created this video series. Here at Welllife, we see this situation not as a health crisis, but a global calling to be proactive and deliberate with our health choices. There are so many lifestyle factors involved in enhancing immune function, and on the inverse, compromising the immune system. For example, one of the fastest ways to diminish your immune system is to allow fear and uncertainty to trigger elevated stress levels. This means it's important to be aware of your fear response and how often you allow yourself to linger in this perception. So let's fight that fear with facts. So what do we actually know so far about COVID? COVID-19 is the disease caused by SARS-CoV-19. The first outbreak was first reported on December 31st, 2019 in Wuhan, China, where it quickly became an epidemic. The first known case of COVID-19 in the US was confirmed on January 20th, 2020, and on March 11th, 2020, the World Health Organization declared COVID-19 a pandemic. It's called a novel virus because we haven't seen it before, so that means we don't know a whole lot about it, and it has spread to every continent on Earth except Antarctica. SARS-CoV-2 likely emerged from a bat virus that made the jump to humans. This is called an antigenic shift, which entails a major change in a virus's protein structure. Antigenic shifts are rare. Prior to this current pandemic, it's only occurred 4 times in the past century. A new strain of H1N1 in 1918, also known as the Spanish flu, a new strain of H2N2 in 1957, the Asian flu, another mutation in 1963, and a new strain of H1N1 in 2019, the swine flu. Because human population has had little to no immunity to these viruses, pandemics are common. The number of COVID-19 cases and deaths are increasing every day, so these numbers are a moving target. So how is COVID-19 transmitted? Just like influenza, SARS-CoV-2 spreads through respiratory droplets that are produced by coughing or sneezing. Transmission typically occurs within 6 feet of an infected person or by coming into contact with these droplets on surfaces and then touching one's face. Fecal, oral, or blood transmission may be possible as well. The virus has been found to endure for several hours up to several days on fomites, which are shared surfaces that can collect the droplets. The virus incubates for anywhere between 2 days and 2 weeks, which means that even without symptoms, people might be transmitting the virus. So the risk of infectiousness is probably about as bad as a bad flu, or perhaps a little bit more. We don't really know. Experts have estimated that SARS-CoV-2 has an R0, or reproductive number, which estimates the number of people any given infected person spreads the virus to from 2 to 3.11. By contrast, the seasonal flu typically has an R0 of 1.3. So what are the symptoms of COVID-19? More than 80% of those infected with SARS-CoV-19 has mild symptoms, and many have no symptoms. However, for those symptomatic, 87% have reported fevers, 67% dry cough, 38% fatigue, 33% sputum production, and 18% shortness of breath. Death is of course what we are all worried about, so let's talk about that for a bit. So what is the COVID-19 mortality rate? Unfortunately, we don't really know. We need real case numbers to know real death rates. The high number of deaths in China is devastating, but may not be reflective of mortality rates in other parts of the world, given the tragic lack of hospital staff, medical supplies, ICU beds, and test kits that China faced. The fatality rate of patients over 80 years old is estimated to be 14.8%. Death in those under 50 appear to be unlikely, with a mortality rate of 40 to 49-year-olds estimated to be 0.4% and 0.2% for patients 10 to 39 years of age. The mortality rate has been varying vastly based on country. The reported mortality rate is highest in Italy at 6.6%, in China it is 3.8%, in Iran 3.3%, but let's take a look at South Korea. In South Korea, which has tested more than 100,000 people, the case fatality rate is 0.65%. Germany has announced that its mortality rate is 0.2%. Just as a comparison, the average mortality rate for seasonal flu is usually about 0.1%. Again, the number of deaths worldwide is devastating, but did you know that cancer in the US has a mortality of 196.8 per 100,000 in men and 139.6 per 100,000 in women? That means that you are at least 144 times more likely to die from cancer than COVID, and some estimate as high as 30,000 times more likely to die from cancer than COVID. So what are you doing to try to prevent cancer? In 2018, an estimated 1,700,000 new cases of cancer were diagnosed in the United States, and 600,000 people died from cancer. As of 3/19, there have been 9,843 deaths worldwide due to coronavirus. Yet today, on average, 48,000 Americans will die of cardiac disease, and only 88 died from COVID. Every day you drive your car, and there are 12.4 deaths per 100,000 people due to motor vehicle accidents. So again, you're at least 9.1 times more likely to die in a wreck today than of COVID, and some estimate even 6,000 times more likely. So just like you wear your seatbelt to prevent fatal car wrecks, we want to help you take steps to prevent COVID. So what's the difference between flu, COVID-19, cold viruses, and allergies? With us still in the middle of cold and flu season, and now coming into allergy season, it's important to determine what is causing your symptoms. If you're coughing a lot, having a fever, or feeling achy, it's probably a cold or a flu, not allergies. That said, allergies can sometimes cause a postnasal drip that can cause a cough or a sore throat, especially in someone with asthma. A few questions to ask yourself to differentiate between colds and allergies would be, what's your mucus like? Is it clear or watery? It's probably allergies. If it's green, yellow, or thick, it's probably an infection, but that doesn't tell us if it's a virus or bacteria. How do your eyes feel? If your eyes are itchy or watery, it's probably allergies. Are your symptoms changing? If no, it's probably allergies. If yes, it's probably microbial. How long has it lasted? An infection usually clears in a week or so, but allergies can last several weeks or even months. If your symptoms show up only in certain situations and typically find yourself sneezing every spring or fall, it's most likely allergies. Another allergy tip-off would be that being in a specific place makes you feel miserable, for example, in a house with a cat. Another common question is, who needs to be tested for COVID-19? If you or your child has a cold or flu symptoms, there's a good chance that your child has a cold or flu, not COVID. As we begin to see more domestic spread of COVID-19 in the United States, please do not rush to your doctor's office or hospital to get tested at the first sign of a fever or cough unless your health is declining and you need urgent medical attention. Your doctor or emergency department likely has very limited capabilities to test for COVID-19, and going unnecessarily to the doctor's office or emergency department may inadvertently expose you or your child to COVID-19 or other infections, and likewise expose other people to whatever illness you may have. Many cases of COVID-19 in China are likely due to the uninfected people becoming infected after exposure while waiting in long hospital and clinic lines to be tested. Unfortunately, currently there are still not enough test kits to test every patient with fever and upper respiratory symptoms. So right now, following the CDC guidelines, the recommendations are to test patients with fever and lower respiratory symptoms, cough or shortness of breath, who have had close contact with a person with confirmed COVID-19, or history of travel from an affected geographic area within 14 days of symptoms onset, or anyone with a severe acute lower respiratory illness that requires hospitalization and does not have another diagnosis like influenza, even without any known source of COVID exposure. So that concludes this video. Stay tuned for upcoming videos on things to do to boost your immune system, like nutrition tips, information on essential oils. We will talk about how to wash your hands properly and how to make your own hand sanitizer. We will also teach you how to perform an osteopathic technique on your family that has been shown to decrease death from 6% down to only 1/4 of 1%, 0.25% during the Spanish flu of 1917 and 1918. One key thing to remember is that exposure plus susceptibility equals an infection. Society has been focusing a lot on decreasing exposure, but almost nobody seems to be talking about how to decrease susceptibility by boosting your immune system. So that's what we plan to focus on during this video series. So stay tuned until next time. If you have any questions or want more information about becoming a patient, please feel free to reach out to us. Thanks.